How does Kinesio tape reduce pain, swelling, and poor biomechanics in orthopedic injuries in athletic populations compared to no tape?
KT tape claims to lift the skin to aid in decompressing fascia. It increases lymphatic return, blood flow, muscle activation, and proprioception. It reduces swelling, pain, and pressure. It can be worn for multiple days, however, it is not proven for all injuries.
First, I'm going to teach you how to prep the skin to apply the tape. Before application, clean the skin thoroughly and possibly spray the skin for extra stick. If possible, remove excess hair and lotions. If a patient has sensitive skin, first add lotion to the skin, remove it, and then apply the tape. Apply the tape 1 hour prior to activity. To prep the tape, make sure the edges are curved, and if they're not, cut the edges so they are curved. Then remove the backing. Avoid touching the adhesive while applying the tape in order for maximal stick to occur. Put the stretch on the tape first and then apply it to the skin. The tape on the end should not have any tension added to it, because if there is tension, the tape will come up from the skin. The tension depends on the amount of support for the specific structure. I will show you the different types of tension. 100% tension is full stretch, and then half tension is 50% stretch, and no stretch is 0%.
Correct taping can provide extra support by the muscles by improving their ability to contract even when it is weak, and helps the muscles from overcontracting or overextending. Some different applications of KT tape or KT tape patterns are eye strips, which provide structural support for the injured muscles, tendons, ligaments, and joints, and you place this directly over the affected area. The next are fan strips, which look like a spider web. So you take 2 pieces of tape with a solid anchor, and then you cut 4 or 5 strips, and then you overlap them to make them look like a spider web, and then this helps with edema and swelling.
This technique of kinesio taping for the knee is for full knee support. Indications for this taping include PFPS and general knee pain. Prep the knee as mentioned earlier in the video. Cut 1/2 strip and place it below the inferior pole of the patella. Begin with 75% stretch and lay the tape down, then remove the edges and lay them down. Next, cut 2 eye strips and begin by placing one on the medial thigh towards the midline. Place the proximal edge down, apply a 25% stretch around the outer edge of the knee, and 50% stretch across the lower knee and connect to the edge of the half strip. Repeat this technique with the strip over the lateral thigh and knee. If you want more support, add an additional half strip over the inferior pole.
You will need 3 pre-measured KT strips for lumbar support taping. To begin, instruct the patient to bend over in a standing position. Apply 2 strips of kinesio tape parallel along the paraspinal muscles with no stretch. Begin from the gluteal region and tape superiorly, anchoring on the thoracic paraspinals. Instruct the patient to stand up straight. Apply 1 strip perpendicular to the previous strips, covering the iliac spines on both sides. Apply 50% stretch in the middle.
This is how to tape for shoulder instability. It helps bring the shoulder back in order to create more joint space and relieve pain. 2 strips are needed. You want to start below the spine of the scap with a 2-inch anchor with no stretch. Then apply a moderate stretch, diagonally over the shoulder blade and end on the top of the shoulder. The last anchor should have no tension. Apply the second strip the same way, parallel to the first with no overlap. Rub the strips to activate.
Begin taping an ankle sprain that aids in lymphatic return by cutting 2 pieces of tape. Cut each piece of tape starting from the bottom up to 1 inch from the top into 4 to 5 strips to create fan strips. Place first anchor strip at mid-shin and applying fan strips over area of swelling. The anchor strip and fan strips should have no tension applied to them. Apply second anchor on the side of the shin where ankle is swollen and lay the second set of fan strips across the first set of fan strips. No tension should be applied to anchor or fan strips.